Okay, today we're going to go over shoulder flexion, internal rotation, elevation, and depression. Shoulder flexion is moving the arm in the sagittal plane with a coronal axis. It involves the anterior deltoid, the coracobrachialis, and the pec major. The anterior deltoid originates on the clavicle and it inserts on the deltoid tuberosity. The coracobrachialis originates on the coracoid process of the humerus and inserts on the middle of the humerus. Pec major also originates on the clavicle and inserts on the IT groove of the humerus. An example of shoulder flexion would be raising a toothbrush to the mouth to brush the teeth. And all of these are concentric contractions except for depression, which is eccentric. Shoulder internal rotation involves the subscapularis, pectoralis major, latissimus dorsi, and teres major, and it is rotating the glenohumeral joint medially. Subscapularis originates on the subscapular fossa, and it inserts on the lesser tubercle of the humerus. Pec major, I already went over the origins of the insertions. It's right here. Latissimus dorsi originates on the lower thoracic and lumbar vertebrae, the sacrum, the posterior crest of the ilium, lower three ribs, and the inferior scapula of the humerus. Inferior angle of the scapula. And it inserts on the IT groove of the humerus. Teres major originates on the inferior angle of the scapula and inserts on the IT groove of the humerus. Example of internal rotation would be reaching the arm around to get the opposite side of the teeth. Shoulder girdle elevation includes the trapezius, levator scapulae, and the major and minor rhomboids. It's lifting the shoulders like this. It's the upward motion. So the trapezius originates on the occipital protuberance, and it inserts on the clavicle. Levator scapulae originates on vertebrae C1 through C4 and inserts on the medial angle of the scapula. Rhomboid major and minor originates C7 through T1 and inserts on the vertebral border of the scapula. And then depression, or the only eccentric contraction, involves the trapezius, latissimus dorsi, pectoralis major, and pectoralis minor. And I already stated the origins and the insertions for the first three, so I'm just going to do pec minor, which is ribs 3, 4, and 5, and it inserts on the coracoid process of the scapula. And shoulder girdle depression is when the shoulders go downward from elevation. So like that, yes, good. So let's say somebody could not achieve full shoulder flexion, internal rotation, or elevation and depression, and they needed to brush their teeth. A possible modification would be a longer toothbrush, so that they didn't have to do full flexion, etc. Or they could forego the toothbrush altogether and use a water pick, which is blast the water into the mouth. And it's not quite as effective as brushing, but it's better than nothing if they can't brush their teeth.